To understand the anatomy of the microsurgery of the lateral skull base, first it is better to read Endoscopy Neuroetology by Professor Jacques Magnan and Maresona. Why? Because you can visualize these root exit zones of the nerves better with endoscopy than microscopy. So, before venturing into the lateral skull base by microsurgery, you practice endoscopy on cadavers and try to identify nerves and vessels. See, there are four anatomical levels of cerebello pontine. The level 1 is the topmost one, that is the trigeminal, that is 5th and 6th nerves, and superior cerebellar artery. And level 2 is acousticofacial bundle and loop of anterior inferior cerebellar artery, ICA. And the level 3 is 9th, 10th and 11th and PICA, posterior inferior cerebellar artery. And level 4 is at foramen magnum. It consists of spinal root of axillary, hypoglossal nerves, and vertebral artery and basilar artery, and PICA. In this picture, this is the trigeminal nerve, and this one is the trigeminal vein, otherwise called Dandy's vein, which is entering into here, which is entering into the superior petrosal sinus. And this one is the 6th nerve below the trigeminal nerve, and it is entering into the Dorello's canal here. This is the Dorello's canal, and this is the free margin of the tentorium. And again, this one, this artery, this is posterior cerebral artery. Here in this picture, this trigeminal nerve before entering into its Meckel's canal, Meckel's cavity. And this is the trigeminal vein, Dandy's vein, entering into superior petrosal sinus. And this is the 6th nerve, and again this is the Dorello's canal. This one is the 3rd nerve, which is emerging between here. It is emerging between posterior cerebral artery, this one, and superior cerebellar artery. And again it is divided into cranial part and caudal part. This one is the caudal part. This one is the cranial part. Above these above the superior cerebellar artery, this 4th nerve comes from posterior to anterior and enters at the free margin of the tentorium and goes into the cavernous sinus. This 4th nerve is the only cranial nerve which originates from the posterior part of the brainstem. So here it is coming from posterior. So this one is the 3rd nerve. It is present between superior cerebellar artery and posterior cerebral artery. This is the free margin of the tentorium. This one is the uncus, and this is trigeminal nerve. This is trigeminal vein. Here the same description like in previous slide. Here the 3rd nerve is emerging between this posterior cerebral artery and the superior cerebellar artery, and again this superior cerebral artery divided into the this cranial part and caudal part. And the superior cerebellar artery is present between the 4th nerve and trigeminal nerve. Here superior cerebral artery is encircling the brainstem between the 4th nerve and 5th nerve. This root exit zone, it is called, the where the nerve emerges from the brainstem, it is called root exit zone, and where it is entering into the not here in 3rd nerve, in other nerves, where it is entering into the bone, it is called root entry zone. So this is the root exit zone, REZ, and here the 3rd root exit zone arises between this posterior cerebral artery and superior cerebellar artery. This is the root exit zone of third nerve, and this is the uncus. This is the left side trigeminal nerve. Suppose if the direction of the trigeminal nerve is towards the left side, it is left side. And suppose if the trigeminal nerve is right side, direction of the trigeminal nerve is right side, then it is right side. And this one is the trigeminal vein. This trigeminal vein here, it is entering into the superior petrosal sinus. This is the sixth nerve. Here it is entering into the Dorillus canal. This trigeminal nerve and vein both are entering from posterior fossa to posterior cranial fossa to the medial cranial fossa through this Meckel's cave. Same thing here also. This trigeminal nerve entering into the Meckel's cavity, and this one is the sixth nerve entering into the Dorillus canal, and this one is the trigeminal vein. Here this nerve and vein and this sixth nerve all are entering from posterior cranial fossa to the middle cranial fossa. Here, this one is the sixth nerve. Here, after piercing at the Dorillus canal, the sixth nerve passes a intradural course. This one is the intradural course. This intradural course, it runs towards medially, and before it entering into the petroclavial area. So it is the petroclavial area. At petroclavial area, it crosses the vertical part of the lateral part of the internal carotid artery. Here, this trigeminal nerve entering into the Meckel's cavity. Here, this major part of the trigeminal nerve is the sensory part. So this one is the larger part. This one. So larger part of the trigeminal nerve is sensory. This one, smaller part, is the motor. Now we will discuss about the pathologies due to vascular compressions. This is in trigeminal neuralgia. The patient gets symptoms due to vascular compression of the superior cerebellar artery, compressing at the origin of the the superior cerebellar artery, compressing at the origin of the trigeminal nerve. Here, this is the origin of the trigeminal nerve and superior cerebellar artery. So here, usually superior cerebellar artery, this loop, usually this artery forms a loops. This superior cerebellar artery exists between the trigeminal nerve and, in this picture it is not shown, between the fourth nerve and the fifth nerve, the superior cerebellar artery encircles the brainstem. So this is the left side, because superior cerebellar artery present right side of the trigeminal. So this is the left side. So this is the trigeminal vein. So here the superior cerebellar artery is compressing at the origin of the trigeminal nerve, causing trigeminal neuralgia. See here, this direction of the trigeminal nerve is towards right side. So this is the right trigeminal nerve, and this is the Dandy's vein. This is the trigeminal vein. See here, at the origin of the trigeminal nerve, the superior cerebellar artery is compressing the origin of the trigeminal nerve, causing trigeminal neuralgia. So because of the direction of the trigeminal nerve towards right side, this is right side trigeminal nerve, and it is this superior cerebellar artery is compressing the origin of the trigeminal nerve here. This trigeminal, this is the trigeminal nerve, and the Professor Magnin has kept a Teflon pad between the superior cerebellar artery and the trigeminal origin of the trigeminal nerve to prevent compression. Usually this superior cerebellar artery has to come above here, but here in this case in pathology it has come down and it is compressing at origin of the trigeminal nerve. So Professor Magnan has kept Teflon pad between origin of the trigeminal nerve and superior cerebellar artery for decompression. See in this patient of left side trigeminal area, because this direction of the trigeminal nerve is towards left side, so this is left side, and the superior cerebellar artery is superior to the trigeminal nerve. So this is the superior cerebellar artery compressing at the origin of the trigeminal nerve, causing trigeminal neuralgia. So here Professor Magnan has kept a Teflon pad between the trigeminal nerve and the superior cerebellar artery for decompression. This is the Teflon pad. This is another case of trigeminal neuralgia. See here in this picture, the fifth nerve is compressed by the inferiorly placed superior cerebellar artery and the vertebral artery, and a branch of the superior cerebellar artery encircling from above. So here in this case, three things are offending. One is the superior cerebellar artery and the vertebral artery and a branch of the superior cerebellar artery. Usually the superior cerebellar artery has to lie above the fifth nerve, but in this case it has gone down and causing the compression of the fifth nerve from below. See, this is the superior cerebellar artery. Usually it has to lie above the fifth nerve. So this is the trigeminal nerve is going towards left side. So this is left side. It has to lie above the trigeminal nerve, but here it is causing compression of the trigeminal nerve from below. So it has changed its axis, and a branch of the superior cerebellar artery also compressing the nerve, and this one is the vertebral artery. Usually vertebral artery won't come up to this level, but this is one rare case, and this one is the dandy V. So the first Professor Magnan has Professor Magnan has done is he changed the axis of the superior cerebellar artery from inferior to superior and kept Teflon pad between the trigeminal nerve and the superior cerebellar artery. So usually normally it has to lie above the trigeminal nerve. So he changed its axis from inferior to superior, and he kept the pad. And when he changed its direction, its axis, naturally the branch of the superior cerebellar artery, which is compressing at the trigeminal nerve, also it is also relieved, and he kept another pad here. See here there is vascular blackening of the trigeminal nerve caused due to compression of the branch of the superior cerebellar artery, and still this vertebral artery is compressing from below. So to relieve this one, this vertebral artery compression from below the trigeminal nerve, he has kept the Teflon pad, another Teflon pad between trigeminal nerve and the vertebral artery. This is the pica, which originates from the vertebral artery. Usually vertebral artery won't come up to this level, but in this case it has come up to this level. In this case of trigeminal neuralgia on left side, because the direction of the trigeminal is left towards left, so this is the left side trigeminal nerve, and here there are no offending vessels, there are no compressing vessels on the trigeminal nerve, but see here this small aberrant vein is passing between the fibers of the trigeminal nerve and entering into the superior petrosal sinus. So this is the problem. This is causing the trigeminal neuralgia. This vein, aberrant vein, is causing the trigeminal neuralgia in this case. So Professor Magnan has coagulated this aberrant vein and removed the compression over the fibers of the origin of the trigeminal nerve. See, in another case of trigeminal neuralgia, this trigeminal vein and superior cerebellar artery. Both are compressing the trigeminal nerve. This trigeminal vein is compressing from above, and this superior cerebellar artery is compressing at supromedial area here. So Professor Magnan he has kept the Teflon pad between this caudal part of the caudal division of the superior cerebellar artery and trigeminal nerve, and here one pad kept between the division of the superior cerebellar artery and the trigeminal nerve. But in the post-op, still the patient has trigeminal neuralgia, so he again posted the case and divided the arachnoid membrane, and he pushed the total superior cerebellar artery a little bit above.